Mitral valve disease is a disease of the valve, the central valve of the heart, called the mitral valve. It sits between the top left chamber and the bottom left chamber, the atrium and ventricle. And the mitral valve is a one-way door, if you will, that is kind of like two French doors that meet in the middle. There's a door frame in the doors, and the problem can occur when the valve begins to leak, or the two doors don't meet in the middle, or it becomes blocked, or what we call stenosis. And that's when the doors are fused shut or they're calcified. Let's start first with how the heart works. There's two top chambers and two bottom chambers. The blue or deoxygenated blood comes in from the right side, goes down through the right atrium, through what's called the tricuspid valve to the right ventricle, and it gets pumped to the lungs. The lungs then oxygenate the blood and bring it to the top left chamber, called the left atrium. Then it crosses this one-way door, the mitral valve, and it goes into the ventricle. The ventricle then squeezes, that's the main pumping chamber of the heart, the motor of the heart. It squeezes, and those two doors come to meet in the middle, and they close. And then all the blood goes through the other valve, the out door, called the aortic valve, to the rest of the body. Now, when there's a problem with the valve, the most common is mitral valve regurgitation, or leaking mitral valve, secondary to what's called primary mitral regurgitation, or degenerative valve disease, or what's commonly known as mitral valve prolapse. Now, when mitral valve prolapse occurs, it's 5% of the population, very, very common. That valve begins to sort of burp, if you will. Those leaflets don't come quite in the middle. And usually by about the 4th decade of life, this valve becomes from just prolapsing a little bit to actually disconnected. There's little cords that support the valve, kind of like parachute cords, that are attached to the pumping chamber or ventricle. And when one or two of those rupture, this is what happens with each heartbeat. And so blood goes back into the top left chamber and then back into the lungs. So what's common is that people develop shortness of breath. They can develop a stretching of that top chamber. When it stretches, the walls tend to fibrillate, or what's called atrial fibrillation. One can get a dry cough, is very common. We offer treatment, and that treatment is for mitral regurgitation, is to repair the valve. Now, replacement is a consideration for some patients, but we do know that when possible, mitral repair is not only better tolerated in the short term, but much, much better in the long term. And so to repair the valve, what we do is we reconstruct the leaflets. So we take those two areas that are potentially not coming together, and we either reconstruct them with artificial cords that have ruptured, or we take a small little segment out and bring the leaflets together so they come together nice and straight, and they come together, and then we support that with a special ring. In other words, we rebuild one of the doors and put a new door frame on. And that results in the leaflets becoming back to normal again. Our center is one of the top centers in the country that do a lot of mitral valve repair. And that can be done through an incision through the front called a sternotomy, or it can be done robotically, and that's done through a small incision on the side. Both are very, very commonly done here, and patients overall do extremely well, and these are generally low-risk operations. Mitral valve replacement occurs when patients have usually calcified disease or rust on the door frames, and the leaflets are rigid. And that's commonly associated with rheumatic fever when they were usually a child, or when their tissues are very, very rigid. And that's done by excising the areas of calcium and providing a new valve, which can be made out of cow or pig tissue, or made out of metal. The cow or pig tissue valves don't necessarily require lifelong warfarin or Coumadin. The metal valves do require warfarin or Coumadin. There's a question that may be asked, is that when we do mitral valve repair, what valve type would you like? Those are really the reasons, and usually for valve repair, your surgeon will be able to tell you the percentage of repairability, which for mitral valve prolapse with no calcium is well over 95% in our institution. Now, the operation itself lasts approximately 4 hours, and you'll be in hospital for 4 days. Now, the key to success is lots of deep breathing exercises and lots of walking. And if you do extremely well, usually home into your own bed, no special arrangements, walking the hallways, and then just no heavy lifting or driving for about 3 weeks. Now, what about the risks? The risks of any heart surgery include the categories of bleeding, infection, stroke, heart dysfunction, kidney problems, and lung problems. The risk of dying and the risks of these complications, your surgeon will tell you based on your existing risk factors. But in general, for mitral valve prolapse, to keep it fairly broad, the risks are very low. Less than 1% chance of dying and less than about 10% chance of any of these other complications. Generally very well tolerated, and people do very well and can return back to work fairly quickly. Particularly either approach, but particularly with robotic approaches. And so that really summarizes what the problem is, what we can do to fix the problem, what the risks are, and what the outcomes are.